Welcome to Ideagen TV. Today we have with us Santore, Senior Vice President, Government and Public Affairs at Providence. Welcome.
Ideagen, I'm thrilled to be here today with Dr. Beth Schenk, our Executive Director for Environmental Stewardship at Providence. Beth and I really value our opportunity to address environmental sustainability at scale, both inside and outside of our organization. Providence is the third largest nonprofit system in the country, and I consider Providence to be more than a healthcare system. We've been on the leading edge of serving our communities for 165 years, doing things not because they're popular, because they were what the community needs. I don't know of another $23 billion organization that was founded by a group of women. And building on the legacy of those strong and incredible women, the Sisters of Providence, Providence now encompasses 53 hospitals, more than 1,000 clinics, and 120,000 employees whom we refer to as caregivers. And when you think about our footprint, not only do we have the 53 hospitals across 7 states, our clinics and our outpatient settings include 17 million square feet of infrastructure. So really looking not only at the care we provide within those buildings, but what's the impact of our footprint overall? I serve at Providence because I find it inspiring. Its legacy and its mission to care for the poor and vulnerable. And we're driven by our vision to advance health for a better world. And we know we can't create health for a better world without addressing the world we live in and the health of our common home, the earth. Along with treating over 50,000 COVID patients last year, we also experienced climate-related catastrophes, one of the worst wildfire seasons ever ravaging our communities in the Western United States, where Providence has a very, very strong footprint. Several of our physicians and our caregivers were directly impacted. These natural disasters have shown us the deep connection between the health of our planet and the health of our communities. And that's why at Providence, we've pledged to becoming carbon negative by 2030. With Earth Day right around the corner, Beth and I want to use this time today to talk a little bit about what we're doing at Providence, and then talk about what we can all do together to heal our planet. So with that, Beth is our content expert here. So I'll start by asking Beth, what role does healthcare play in climate change? And how is our commitment at Providence aligned with and in support of the UN Sustainable Development Goals?
Well, thank you, Ali. And that's a huge question, and one that I'm excited to address, and really excited Providence is addressing. So as you know, and as the listeners know, the UN Sustainable Development Goals provide a comprehensive framework based on health, well-being, and equity on a global basis. They're described as 17 goals to transform our world. And in Providence, we say our environmental stewardship is a transformation process. So we are addressing many of these goals, the Sustainable Development Goals, in our own way, from fighting poverty, building health, providing education, focusing on diversity, equity, and inclusion. From an environmental health perspective, our goals align nicely as well, particularly for clean water, affordable energy, sustainable cities, responsible consumption, and of course, climate action. I've just listed 9 of the SDGs, all of which are deeply embedded in our plans. In fact, healthcare around the world has a major role to play in environmental health and climate stability. Our climate crisis is considered the most significant public health crisis ever. Now that we have reached 1 degree Celsius of warming, we are seeing the impacts on health from heat, storms, wildfires, vector-borne diseases, respiratory illness, and more. It is hard to imagine 4 degrees of warming by the end of the century, which is projected if we keep on a business-as-usual path. Scientists have some projections of what that might mean, but I fear that we have a lot of unpleasant surprises as it actually unfolds. This is why, from a health perspective, we must act. Ali, I think a lot about our heritage in Providence, as you outlined. Mother Joseph began building hospitals in the United States 150 years ago, and our heritage from the Sisters of St. Joseph goes back hundreds of years in France. Our forebears have been caring for members of the communities we serve for a century and a half. When we look ahead to the predicted outcome of extreme warming by the end of this century, which is really half the time Providence has been around, that reminds me of the urgency of addressing this now so we can avert the worst. A second reason why healthcare is and needs to be concerned about our environmental crisis is that healthcare is polluting, especially in the United States. If global healthcare were a nation, we'd be the 5th largest emitter, with the US responsible for about a quarter of that, though hundreds of countries offer healthcare. So we need to take accountability for our own results and demonstrate leadership to others as we can. Thank you.
And so, you and I know that Providence, along with other large organizations, it's very difficult it's easy to say something and it's much harder to actually get something done. So how are we involving the entire organization in our commitment? How will we get to becoming carbon negative by 2030?
Well, that keeps me up at night, Allie. And as you said, Providence is a large and complex organization stretching from Texas to Alaska in the Western United States. Meeting our goal will require a lot of changes in operations, from waste reduction to energy efficiency to what we purchase. We are starting with our hospitals. We have over 50, as you said, and we estimate that our hospitals account for about 85% of our carbon emissions. So environmental stewardship is situated in our organization, in our advocacy division, which you lead. We work very closely also with our real estate division, the buildings. Yet to actually transform our processes and outcomes, we need to work in many areas at once. We have established a cross-divisional leadership team, the Transformation Circle, in fact, representing about 18 divisions in our organization. We have identified regional leaders across our 7 regions to help make changes on the ground at the hospitals and clinics. We have local green teams to help engage staff across the organization. We have an environmental stewardship procurement committee. We are soon rolling out a new system-wide policy that asks all procurement decisions to consider the environmental impacts of that decision. We are also engaged with the Health Anchor Network on purchasing decisions that support local communities and diverse business owners. Also, we are currently engaged with a consultant to perform a high-level Scope 3 assessment to better understand the carbon impacts of our Scope 3 emissions, our indirect emissions, which are largely through our supply chain. We are also using a framework that we developed called the We Act framework, and I'm just going to go over this briefly. This is both a mnemonic, so people can remember it, and an acronym. It's also a message that we will only be successful if we act to address this problem. So the W is for waste. Healthcare produces enormous tonnages of waste in 10 different waste streams. This is a problem for our carbon footprint, first because the treatment and disposal of waste is energy intensive. But the bigger reason is that it points to extreme and often excessive consumption in the first place. So source reduction, or reducing the amount we purchase and use, is our primary focus. The E is for energy and water. Healthcare uses a lot of both, especially in our buildings, which run 24 hours a day, 7 days a week, with high needs for air exchanges for infection prevention, heating, and cooling. We are focusing on decarbonizing the energy grid through advocacy, increasing the amount of renewable energy we purchase, and to a lesser extent, installing renewable systems at our sites. A is for agriculture and food. Food has been estimated to be responsible for up to 1/3 of our global greenhouse gases. In healthcare, we can do our part to reduce food waste, to purchase foods with lower carbon intensity, and to increase access to local and sustainable foods. The C is for chemicals. In healthcare, we use anesthetic agents, nitrous oxide, refrigerants, and pharmaceuticals that are also greenhouse gases. We are working to understand where these chemicals are in our processes and to reduce their use and/or to capture them appropriately to drive down our emissions. The T is for transportation. As recently as 2018 in the United States, transportation surpassed buildings as the largest sectoral contributor of greenhouse gases, according to the EPA. For this reason, we are working hard to reduce business travel as well as employee commuting. This is challenging, especially in the Western US, where public transit is not always available and where we cover vast distances. I mentioned that the message that we act is crucial, and that's because caregiver engagement is the secret sauce, I say, to do this transformation. And we are aiming to do it in this decade, in no small order. Thanks for asking. So, Allie, I have a question for you. We know that we cannot do this alone, and you are engaged particularly as our Chief Advocacy Officer with external partners. You lead advocacy for our entire organization. Tell us about how we are engaged externally.
Absolutely. And Beth, to be honest, we made our commitment at Providence to become carbon negative, not only to hold our own organization accountable, but really to serve as a call to action to others. So as Beth shared, healthcare is a large polluter of greenhouse gas emissions in the United States. The healthcare industry in the United States emits the total greenhouse gas emissions of all of Great Britain combined. And Beth talked a little bit about how we are organizing ourselves internally to address our own footprint, but we are also forming partnerships externally and using our national voice to lead in partnership with others. So Providence is the founding member of the Healthcare Climate Alliance in both Washington State and California. These are alliances formed between health systems to advance policies at the state level that improve the health of our planet and address sustainability. So through these alliances, we have actively supported clean building standards and legislation to change the way that buildings are built to make them more climate friendly, and also clean fuel standards at the state level. At the national level, for the last 4 years, we've been proud members of the We Are Still In coalition that upholds the commitments of the Paris Climate Agreement. We're also signatories of the Race to Zero, which is a multi-stakeholder effort to bring organizations to zero emissions. We're also active members of Healthcare Without Harm, and we have a strong partnership with Microsoft to advance our sustainability goals. We know that we can't do this alone, and we welcome the opportunity to partner with others. Our CEO, Dr. Ron Hochman, is chair of the American Hospital Association right now for this year. We are incredibly proud of his leadership and the opportunity that we have to really inspire healthcare systems and providers across the country to take our lead to addressing their own footprint and to really tackling what healthcare can do together to improve the health of our planet. Because we know at Providence, we can't have healthy people without a healthy planet. So we really want to use our national voice in order to inspire others. And you know, Beth, one of the biggest components of our commitment at Providence is our focus on equity and health equity. How does our initiative address equity in terms of our strategies and successes? You know, our country has been through such a tumultuous year, and really what I consider to be a reckoning around equity as a whole. And then for us, translated into healthcare, how are we addressing health equity, and how does our commitment to environmental sustainability, how does that relate to our commitment to health equity?
Yeah, thank you. It's such an important question, in part because our heritage, as you said, has always focused on equity. In fact, we, in our mission statement, it's very clear that we aim to support the poor and vulnerable, as well as folks with more means. And that really gets at our concerns about equity. We want to care for and ease the way of people living with poverty or homelessness, and also those who are more vulnerable to health risks of all kinds, including environmental health risks. These include the very young, the elderly, BIPOC communities, people with chronic health conditions. These groups are all more vulnerable to pollution and the impacts of climate change. We are fortunate in Providence to have structures, habits, and a heritage that addresses the needs of vulnerable individuals and groups. Through our environmental stewardship program, we are broadening the lens we use to include environmental and climate risk. In fact, we have convened a cross-divisional environmental justice collaborative to learn more, and later this year to make recommendations to leaders and decision makers for including environment and climate as determinants of health. We just had a meeting today, in fact, and learned a lot more about the data that's currently available to us to understand these impacts in the communities we serve. Another aspect of that has been around for 30 years, we are, I'm told, the only healthcare organization that owns our own medical supply recovery organization. And through this, we are able to take back supplies that are new and unused and unexpired that we would otherwise throw away, shockingly, and we're able to collect them and distribute them to places that have needs around the world. So we have been sending these to other nations as well as domestic programs that are in need of clean, high-quality supplies, the same supplies we use in our care. That's an important aspect of our a marriage between our environmental stewardship to reduce waste and also our equity lens. We have seen new realities in the past, really pretty recently, 4 or 5 years, especially along our West Coast states, with wildfires and urban pollution. And this is really bringing to the fore where the schisms are in our society for folks who are more exposed to these harms. So I'm proud of Providence for taking this on and realizing that we need to also use the lens of environmental risk in our needs assessments. Thank you. So Allie, I have a question for you. We know that this work, reckoning with our environmental and climate crisis, is very challenging. Yet, as you say, it's imperative. This is who we are, and we feel this need to respond. What would you say, especially with a recent change in our government leadership, what does the future look like for our nation as it addresses climate change?
That's a great question, Beth. I firmly believe that sustainability strategy is business strategy. Our goals as an organization and the health of our environment are inextricably linked. We are buoyed by President Biden's administration and commitment to addressing climate change. We welcome the opportunity to partner with his administration and our state leaders. And I often say that Providence is a microcosm for the country. So we operate in states like Oregon, Washington, and California, but also Texas and Alaska, states that rely heavily on the oil and gas industry as really their economic engine. So if we can meet our goal to become carbon negative across our diverse geographic and demographic footprint, we firmly believe that it can be done for the United States as well. So policy is going to be on the leading edge of that. Over the last 4 years, there have been hundreds of policies that have been enacted that really loosen our regulations around environmental protection. So I see the Biden administration first engaging in kind of what you can consider the great undoing of policies that were enacted over the last 4 years to get us as a nation to a point we were 4 years ago when it comes to climate change commitment. At that point, once many of those policies of the last 4 years were reversed, he will then continue to move forward with how we can be even more aggressive in our strategies. I don't think that there's the appetite to enact the Green New Deal or a sweeping climate change bill. But I know that the Biden administration and Democrats in Congress are very much looking at an infrastructure package to improve our roads, highways, infrastructure across the nation. And I think there's going to be a strong role for environmental sustainability in that infrastructure package. The health of our planet should not be politicized. It is truly going to benefit our businesses, our communities, and our generations to come. So we really look forward to, in a bipartisan way, partnering with the administration on their goals to improve the sustainability of our planet.
That's great, and it's optimistic. Thank you for that, and thank you for your leadership. I learned so much from you regarding advocacy. So let me ask you, Allie, after working on this for several years now, what are you most excited about and proud about related to your leadership in environmental stewardship for Providence?
Well, Beth, I wouldn't really say it's my leadership, but I would say related to our commitment to environmental stewardship, I'm most proud of the commitment from our caregivers. So as we mentioned, we have 120,000 caregivers, 7 states strong within our organization. And the passion that they feel for this work is infectious. I also shared and touched on some of the both personal and professional struggles that our caregivers have gone through over the course of the last year, being on the front lines of the COVID-19 pandemic, also suffering from the wildfires across our footprint last summer. But I really see their passion for the environment and our commitment. I see them channeling such positive energy into this work. One of the things that you've been so instrumental in is the formation of green teams on the ground in our facilities. These are caregiver-led grassroots movements within the walls of our hospitals that lead to specific improvements within those hospitals, whether that be recycling programs or waste reduction programs. And we now have over 40 green teams across our system. And those are all people who come from caregivers and leaders who have day jobs, who have regular jobs to do, raising their hands and saying that this is important for my community, this is important for my hospital. And it's really led to a shared commitment and an increase in morale in what has been an incredibly difficult year. So I really see this work as work that our caregivers can rally around. It's a shared purpose. It's a shared cause for all of us to support. And that's what I'm most proud of. And Beth, I would ask you the same thing. What are you most excited and proud of about your leadership in environmental stewardship for our organization?
Well, I echo what you've said. And also, I would say I'm really proud of Providence leaders. I'm proud of Providence for making this bold commitment. I've worked with Providence for a while now, and over the years, I have seen that Providence doesn't shy away from doing hard things. Our leaders, once leaders, are resolute about the importance of it. So I feel like that has evolved in these past few years. And I'm just really proud that our organization is responding to this great need of today. Our sisters before us said that we'll respond to the times. And I feel like that's what's happening in Providence right now. The great need of today being, from my perspective, one of the great needs being our environmental crisis. It takes foresight and vision. And, frankly, we need more organizations and nations to take this on as well. And I, too, am proud of the thousands of caregivers who are concerned about our environmental crisis, who have been speaking out about it for a while, and who want to be involved. As you say, this is often on top of other duties as assigned, but it helps feed their soul, I believe. Mm-hmm. In fact, I've been kind of surprised during the pandemic this past year that many people seem actually relieved to talk about climate change, of all things, which is usually very stressful. But I think it's because they see that we're taking action, that we have a plan, that we're moving forward, that we acknowledge the reality of this incredible challenge. So, on a personal note, I would say this commitment from Providence brings me solace. I personally feel better because sometimes it feels like this is an unsolvable problem. Mm-hmm. I am heartened because I know what Providence can do when it puts its formidable energy behind a goal. And I hope this is the case for our caregivers too. I hope they feel relieved by this, and members of the communities we serve, as well as other health organizations. It definitely makes me proud.
Absolutely. I couldn't agree more, Beth. And we are so lucky to share a backyard with other Ideagen members like Microsoft and others who have stepped forward in this commitment with us. So I truly believe that Ideagen members are on the leading edge of improving the health of our planet, and really look forward to working with within our organization and within our partners with Ideagen to advance environmental stewardship and the rest of the UN Sustainable Development Goals as well.